Hello, good afternoon. For today, we will be talking about MMPI or the Minnesota Multiphasic Personality Inventory. So in this chapter, we will discuss about the history and development of the test, reliability and validity. We will also be talking about the assets and limitations of these tests, administration, as well as the interpretation, and lastly, the computerized interpretation. So let's talk about the history and development of the MMPI. The original development of the MMPI began actually in 1939 at the University of Minnesota. And behind this test, the creator is none other than Stark Hathaway and Charlie McKinley. So original item pool ng test is actually 1,000 statements derived from a variety of different sources. So dito papasok yung previously developed skills, personal and social attitudes, clinical reports, case histories, psychiatric interviewing manuals, and personal clinical experience. So from 1,000 pool or questions, nabawasan siya, na-improve, and then naging 504 siya. So first published by the University of Minnesota Press in 1943. So nung na-develop nila yung test, ang una ginawa nila is kinausap nila yung friends from the University of Minnesota Hospital na sila muna yung mag-answer nun from doctors, from patients from the hospital. And then after 1943 nang na na-publish siya, it was replaced by an updated version. Ito na yung MMPI-2 and it was developed in 1989. And then after that, nagkameron siya ng another version which is the MMPIA. So this is for yung adolescents. It was published in 1992. And then yung recent is yung alternative version of the test. Ito naman yung MMPI 2 RF o yung restructured form. So ano nga ba yung Minnesota and ano ba yung purpose ng MMPI? So this is a standard psychometric test of adult personality and psychopathology. So psychologists and other mental health professionals use various versions of the MMPI to, help develop treatment plans, assist with differential diagnosis, help answer legal questions for forensic psychology, and then for job screening naman and personal selection, ginagamit din siya as part of the therapeutic assessment procedure. And then yung MMPI is most widely used personality inventory with more than 10,000 published research references. So, ganun siya katindi. Kaya sikat ang MMPI. So, dun sa MMPI-2, the test contains 567 questions, all which required mag-answer ka ng true or false response. Although this is the oldest MMPI, still ito pa rin ginagamit. So, yung candidates are expected to complete the test in 60 to 90 minutes. So mahaba talaga siya. Yan yung parang isang dilema kung bakit yung iba nahihirapan kasi sobrang haba talaga niya. So, yung MMPI-2 naman o yung restructured version, yung updated version na na-introduce ng 2008, the number of question is reduced to 338. So from 567, naging 338 siya. But it still requires you to provide a true or false answer. Yung test is you need to relatively answer the question honestly. And then candidates will have between 35 and 50 minutes para matapos yung test. And yung MMPI A naman o yung for adolescents, so dinesign siya for teenagers to help identify behavioral, social, or personal problems. And aim ang aim neto is for those between 14 and 18 years of age. And probably not one that you will encounter during the recruitment process. So next naman, ito yung pinakang ano niya, validity, basic clinical and content ng Minnesota Multi-Facet Personality Inventory Scale. So dito makikita natin yung validity scale niya, which is yung name, andito yung abbreviation, scale number, and number of items. For basic clinical skills naman, dito nagbibilong yung hypochondriasis, depression, hysteria, so on and so forth. Yung content scale naman niya, andito yung anxiety, under siya ng fears, obsessiveness, depression, and then doon sa number of items, makita mo kung ilang items siya. 98 for example, 40, for hypochondriasis, meron siyang 32. So ito yung example niya. Let's go naman with reliability and validity. So MMPI was one of the first tests to develop scales to detect whether respondents were answering in such a manner as to invalidate the overall result. So, a sample of MMPI research published between 1970 and 1981 was analyzed to yield reliability and stability estimates for the MMPI scales. So, in fundamental agreement with previous research, moderately high levels of reliability and stability were found for all cases. So mataas yung reliability niya based on sa research. And then pagdating sa reliability and validity ng MMPI, isa tong test na to na may pinakamaraming studies. Yun nga lang, there are proponents in MMPI, kumbaga may mga counter fluctuation siya in test scores na kailangang expected. Kasi especially dun sa mga psychiatric population, so dun sa mga patients, dahil sa effects nung treatment or stabilization or in a temporary crisis like yung reflected patient's test performance. So, meron siyang fluctuation which is given naman siya. Reliability values range from 0.71 to 0.84. Stability values niya range from 0.63 to 0.86. So these findings are based on thousands of adult subjects from college, psychiatric medical, alcohol or drug rehabilitation and prison population. Yun nga, marami siyang research na ginawa sa reliability. We're not gonna dig in more of this. But the thing is, reliable siya and valid this test. Kaya sobrang daming gumagamit nito. And then, na-publish din siya sa 50 countries. Ganun siya katindi. When it comes to assets and limitations naman, meron siyang advantages and disadvantages. So, sa advantages, una-una, yun nga, sinabi ko earlier, it has been translated into more than 50 languages and is available in numerous countries. It is most highly used and most research. Yun nga sinabi ko kanina, maraming research na ginawa about sa MMPI from reliability and validity, so on and so forth. Yung MMPI, assets na, yung advantage niya is best for assessing personality and confirming diagnosis. Another one, yung presence of validity tests in addition to clinical and personality information, nandun siya lagi. And another one, advantage is it is theoretical, no personality theory is associated to it. Pagdating naman sa disadvantages, yun nga, sobrang haba ng MMPI. So yun yung isang naging problema, extensive length niya, yung disadvantages niya. Moderate lang yung level of reliability, but it's okay. Personal nature of some questions, medyo may ibang questions kasi na personal and subjective. Problems to related to constructions of the scale such as item, may mga overlap siya. High intercorrelation sa mga scales, another disadvantage niya. And another one is ability to read and write is a must. So syempre, sa sobrang haba na ito, kailangan marunong magbasa para makukuha ng exam na to. Some of the criticism pa ng MMPI is relating to obsolete norms. Yun nga, may mga offensive items and poorly worded items. Pero na-corrected naman siya sa publication. Complicating aspect ng MMPI is that interpretations often need to take into account many demographic variables. So mamaya pag-uusapan natin yung mga variables na yun. It is desirable to know, eto na nga, yung age, sex, socioeconomic status of the subject, and whether he belongs to any minority culture. Kasi nga, di ba, since, for example, here in the Philippines, yung MMPI na develop sa Western country, sa US, which is may mga possibility na talagang hindi siya applicable sa sa different cultures. Like for example, in the Philippines, minority groups or mga ethnic groups. That's why isa din yun sa yung limitation ng test. When it comes to the demographic variables, so unahin natin yung age. So typically daw, merong mga elevations na nangyayari sa scales ng 1 and 3 for older normal population. Aside from that, the scale 9 is more commonly elevated in younger persons but decrease with age until it becomes the most frequent low point in older population. So ito yung mga demographic variables specifically sa age. Sa study ni Swenson and Person and Osborne, provide a list of 30 items that are likely to be affected by aging, such as MMPI, yun nga, yung item 9. I'm about as able to work as ever was, false, yung mga ganong issue. An analysis of these items indicate that older person generally express a decrease in hostility sa pagdating sa age. When it comes to ethnicity naman, yung MMPI sa MMPI2 has been extensively studied to determine how appropriate it is to use with cultural yung mga divergent groups. So research on African American versus European Americans, MBBI performance has frequently indicated, eto na, may difference siya, that African Americans are more likely to score higher on scale F, 8, and 9 compared dun sa European Americans. So yun nga, may mga differences siya kasi meron tayong different cultures na kinalikihan. That's why hindi siya agad applicable sa ibang groups when it comes to ethnicity. Social class and education. So kung pag-uusapan naman natin, the original MPPI actually was standardized on a group that kung saan yung standards would be considered be poorly educated. Person with quite low education levels may have lower overall scores so that they need to be interpreted with caution. Yun nga, dapat marunong ka magbasa and magsulat dito sa test na to. On the administration naman, the MMPI and MMPI2 can be administered to persons who are 16 years of age or older with an 8th grade reading level. Yun nga, lagi siyang important yung reading level. As noted, it is possible to administer the MMPI to persons between ages of 16 and 18, but adolescent norms need to be used. The preferred option for individuals between ages 14 and 18 is to have them take the MMPI. Yun yung for adolescents. Examiner should explain, pagdating sa administration, examiner should explain sa client yung reason for testing and how the result will be used kung paano siya, yung magiging resulta nyo dapat well explained siya before magbigay. And we need to remember that only professional can give this test, especially in psychologists. It might be clarified also that some or even many of the questions might seem a bit unusual. So may mga kakaibang questions nga. Medyo offensive and subjective yung ibang questions dito, which is answerable naman siya ng yes or no. True or false lang. The MMPI have only one booklet from, although these are available in either may soft cover siya or hard cover. Completion of the first 370 items on the MMPI2 and first 350 items on the MMPIA allows for the scoring of basic validity standards and clinical scales. Tapos, aside from that, meron din siyang online. So, an online computer administration is available through National Computer System. Some clinicians allow the clients to take the MMPI under supervision. So, pwede siyang gamitin sa bahay with such, unsupervised condition, pero depende pa rin naman sa client mo. When it comes to interpretation procedure naman, meron tayong 8 steps na recommended. But, lagi natin tatandaan, sa MMPI, these steps should be followed with a knowledge and awareness of the implication of Yun nga, yung diniscuss ko kanina, demographic variables such as yung consideration sa age, culture, intellectual level, education, social class, and occupation. Kasi nga, may mga level of skills na may mga taas yung result sa mga specific test doon. Okay, so unang step, completion time. Hindi na tayo magiging technical when it comes to the interpretation procedure. So, una-una daw is yung completion time. The examiner should note the length of time required to complete the test. So, sa una-una pa lang, dapat natin sabihin yung completion time kasi mahaba to. Dapat may proper expectation na agad yung clients natin or yung pasyente natin. For a mildly disturbed person who is 16 years old, yun nga, mildly disturbed person or older with an average IQ and 8th grade education, meron siyang total completion time should be approximately at least 90 minutes siya. Usually, yung MMPI takes 60 minutes to complete with computer administration. Meron siyang take 15 minutes less than. So, parang 45 minutes siya in total. Yun sa computer. Computer administration are usually 15 to 30 minutes shorter to 75 minutes in total pagdating sa computer administration. If 2 or more hours, ito isang ano din, dapat nating tandaan. If 2 or more hours required for the MMPI or 1.5 or more for MMPIA, meron siyang interpretive possibilities must be considered. So may mga consideration din tayo. So una-una, pag ganun daw katagal, lagpas ng 2 hours yung required, meron sigurong major psychological disturbance yung pasyente natin, particularly severe depression or functional psychosis, or possibility din na meron siyang obsessive indecision, below average IQ or poor reading ability, or meron din siyang cerebral impairment. Step 2, score and plot the profile. So, kailangan natin i-complete yung scoring and huwag kalimutang i-plot yung profile. Yung step 3 naman is you need to organize the scales and identify the code type. For example, the scores can be summarized by simply listing the scores according to the order in which they appear on the profile sheet. So, meron siyang L, F, K, 1, 2, 3, etc. with their T-scores to the right of these scales. For the purpose of this communicating skill scores, T-scores rather than raw scores should be used. Step 4 naman, you need to determine the profile validity. So assess the validity of the profile by noting the pattern of the validity scale. Step 5, you need to determine the overall level of adjustment. So note the number of scales over 65 and the relative elevation of these scales. Yung step 6 naman, describe symptoms, behaviors, and personality characteristics. So interpretation should be treated cautiously with more extreme descriptor being deleted or replaced to present milder characteristics. Step 7, huwag kalimutan, provide diagnostic impression. So although the original MPPI as well as the MMPI2 have not been successful in leading directly to diagnosis, they can often, huwag kalimutan, contribute considerable information na relevant doon sa diagnostic formulation natin. And lastly, you need to elaborate on treatment implications and recommendation. So, often, one of the most valuable service a practitioner can provide is to predict the client's likelihood of benefiting from intervention. So, tanda natin, this typically means elaborating on the person's strengths and weaknesses, level of defensiveness, yung ability to form a treatment relationship, predictive response to psychotherapy. So, yung mga ganong insights. Like, for example, antisocial tendencies and level of insight. Pagdating naman sa computerized interpretation ng MMPI, computerized interpretation systems are important and frequently used adjunct to MMPI interpretation. So ngayon, dati kasi hindi pa naman ganun kasikat yung computerized examination. Kumbaga, ang pinakang variance lang is more like paper and test lang. So ngayon, this modern generation, kumbaga nag-evolve na tayo, more on gadgets na. So, meron tayong computerized interpretation. So, nag-start siya actually 1965 when the first system was developed by Mayo Clinic. Tapos ang pinakang provider niya, yun nga, nasasabi ko na kanina yung National Computer System, Psychological Assessment Resources, or RPISI, and Clinical Service Incorporated. Yun nga, may caution nga lang tayo in the use of different computer-based interpretative system. Kasi kailangan tandaan, it is important because yung interpretative service and software package are highly varied in terms of quality and most of them have untested or only partially tested validity. Pero yung rationale kasi nito is computerized system is that they are efficient and can accumulate, integrate large amounts of information kasi nga mabilis lang sila makakuha ng mga information kasi nga computerized na. However, yun nga lang may study si Garth Marnat na questions have been raised regarding misuse. In particular, computerized services are limited to standard interpretation and are not capable of integrating the unique variables usually encountered dealing with clinical cases. So iba pa rin kasi, based on sa study ni Grath, um, iba pa rin yung pinakang face-to-face pagdating sa yung clinical intervention, kumbaga pagdating sa pinakang um, clinic mismo. Iba pa rin yung basis niya compared sa computer test. In response to this issue, nagkameron naman yung APA or yung American Psychological Association. Nag-develop sila ng guidelines kung paano yung they ensure the proper use of computerized interpretation. That was 1986 hanggang 1984 na pina-follow natin para kahit paano maging reliable and valid yung results ng exam. So, I think that's all. We've talked about the history and development, reliability and validity ng MMPI, the assets and limitations, administration, interpretation, and lastly, yung computerized interpretation. So, I think that's all and hope you have learned something in this topic. Thank you so much and have a great day.